Okay, yeah, I'm Larry Hamilton. My co-author Tom Safford couldn't be here today, but either of us would be happy to answer any questions anybody has about this. Um, I'll just go straight to the talk here. So the title sort of tells you where we're going. Conservative media consumers less likely to wear masks and less worried about COVID-19. Those are findings that emerged from a survey, and we've we just published yesterday, as Nick was saying, a Carsey Perspectives brief. You can download, anybody can download this from the Carsey School website. So if I go past graphs and you can't quite read the numbers, or you want to figure out exactly how was that question worded, any sort of details like that, or how does this relate to other things we've written, I recommend you go to the Carsey website and download this brief and see for yourself. The briefs are set up with a series of small key findings on the front page, and then the details are in the text. What this is describing is a New Hampshire statewide survey that Tom and I organized with the Survey Center for the University of New Hampshire. And this was conducted in the second half of July. So the survey wrapped up, I think, about July 29th, and that's where we're looking back, drawing these conclusions. So what did we do? Well, there's one question we've been asking on surveys since at least March, standard question: do you approve or disapprove of the way President Trump is handling the COVID-19 or coronavirus situation? And what you see here, I'm comparing the March survey results. We did a survey very much like this with exactly the same question in March. And the top graph here is the results from that survey, 650 New Hampshire residents. And of those 650, we got about 30% saying they strongly approved of President Trump's handling of the COVID-19. And we got about 49% strongly disapproving. So there's a 19-point gap between the strong disapproval and strong approval. That's a huge gap. Really striking thing here is that the middle is hollowed out. There's just about nobody that only leans to approval or leans disapproval or says they don't know. Just about everybody either strongly approves, 30% strongly disapproves. So that was in March. Here you see the same question in July. This time we interviewed 959 people, or 959 completed the survey. And in July, instead of 30% strongly approve, it's down to 24. And instead of 49% strongly disapproving, it was up to 58. So the 19-point gap we saw in March has widened to a 34-point gap in July. But once again, you see this pattern that everybody's at the extremes. It's completely hollowed out in the middle here. Lots of survey questions, you get people choosing sort of middle of the road answers. They don't on this. It's very strong feelings, either strong approval or strong disapproval. So who had those feelings? Well, the obvious thing is that it's partisan. And what you see here, this is just the July results only. And I've broken them down here by Democrat, Independent, or Republican. And, small numbers, but among Democrats, nobody strongly approves. I think maybe one person somewhat approved, just 0.00098% strongly disapprove among Democrats. Among independents, which is a sizable group in New Hampshire, very little approval, 12% strongly approve, 9% somewhat approve, 63% strongly disapprove. So there's overwhelming majority, not only among Democrats, but also among independents, that strongly disapprove of President Trump's handling. Then down here, among Republicans, you see the situation reversed. The majority of Republicans say that 56% say that they strongly approve of Trump's handling of the coronavirus. And relatively small numbers. There's more disapproval among Republicans than there is approval among Democrats. So there's something of a difference there. And you notice the strong approval numbers are not as big as the strong disapprovals. Nevertheless, you see, a very different partisan response. One group is saying he's doing great. Another group is saying this is a disaster. Okay, let me go over four other questions that we asked, and I can go back to these if there turn out to be any questions. But one of the questions was, which of the following describes your current behavior? Do you all regarding wearing a mask in public? Do you always wear a mask when you go out in public? Do you always do it except when you're outdoors and able to socially distance? And we had 29% say always, and 48% say they always do except when they're outdoors and socially distancing. So altogether, that's about 77% who always or almost always say they wear masks. Only 15% said they sometimes wear a mask and 7% never. So we've got about 22% down here who say they sometimes or never do. So high compliance with mask wearing hasn't been mandatory in New Hampshire. Some businesses and organizations are requiring or recommending it. But in any event, we see very high willingness among New Hampshire residents to go along with this for their own protection and the people around them. Another question was, how worried are you that you or someone in your family could become sick from COVID-19 over the next year? And 26% said they were very worried. That's this bar here. Another 31% said they were somewhat worried. So that's about 57% overall who are very or somewhat worried that they or a family member will become sick over the next year. Then again, there are people who are not worried. 25% said they were slightly worried. 18% said not at all. So combining those, you've got about 43% who aren't very worried, and 1% gave no answer. So here are the people who are worried. Here are the people who aren't worried. And in every question, of course, you see some spread of opinions. The issue of the day seems to be whether the federal and state governments should prioritize containing the spread of COVID-19, even if that harms the economy, or alternatively, restarting the economy, even if there are risks to public health. And the question was worded that way. 60% said the highest priority of government should be containing the spread of COVID. 30% said highest priority should be restarting the economy. So this is a 2-to-1 margin in favor of the highest priority should be containing the spread of the disease. Our third question in this vein, I guess this is our fourth question in this vein. Again, looking at sort of the large scale, we asked which of the following do you think is most accurate about the situation with COVID-19 in the U.S.? Do you think the worst is behind us? The worst is yet to come? Or COVID-19 has not really been a problem in the U.S.? So what we have, 59% took the gloomy view that, which coincides with what a lot of experts are saying, that the worst is yet to come. As you'll see, a lot of people are worried about what happens in the winter season as people live more indoors, and we've also got other things like the flu season kicking in. So 59% said the worst is yet to come. 21% took a more cheery view that the worst is behind us, and 6% said it was not a problem. Here we had a fairly large group that didn't know or gave no answer to that question. 14%. So 59% worst is yet to come, 21% behind us. All right, here's where we started to ask. In survey research, of course, you want to know what's that 15%, that 59%, and so forth. That's the first set of questions you answer. But the next set is, well, who said that? And as we started looking at that, we found a pretty strong pattern that the way people answered those questions, the four questions you've just seen, depended a lot on where they get their news. And most dramatically, it depended on whether they were frequent viewers of Fox TV news. So what you see here, what this graph shows, is the last four questions, the percentage who say they almost always wear a mask, the percentage who are worried about their own health or their family, the percentage who think the highest priority is containing the virus, and the percentage who think that the worst is yet to come. And in each of these smaller panels, the top bar is people who frequently watch Fox News. That's the orange bar. Let's see, I think I've gone one slide too far here. All right, I'm sorry. The orange bar is people who frequently watch Fox News. The maroon bar, if you can see the colors, is people who just say they occasionally watch Fox News. And the blue bar is people who say they never watch Fox News. And in each of these graphs, there's a faint gray line there showing the overall percentage. So this is always or almost always wear a mask in public. 86% of the non-viewers said that, and 50% of the Fox viewers. So there's a big behavioral gap, about 36 points, between people who frequently watch Fox News and people who say they never watch Fox News. And the ones who occasionally watch it are somewhere in between, maybe a little bit closer to the never watchers. What about, are you worried about your health or family? Well, overall, as we saw, it was about 57% were worried that they or a family member could become sick over the next year. Among never watchers, non-viewers, I guess I should say, that rises to about 66% were worried. Among occasional watchers, again, they're sort of like the non-viewers, about 58% were worried. Among frequent Fox News viewers, only a quarter, only 25% were worried they might become sick. Okay, what about the government's priority? Well, here on these larger questions, the gap becomes really huge. 81% of non-viewers thought the highest priority should be containing the spread of the disease, compared with only 12% of frequent viewers. So there's an enormous gap there. This is the group that's saying contain the virus, because otherwise people will get sick, and also that'll tank the economy anyway. This group is saying restart the economy even if people get sick. So quite a large difference there. And as for the future, the worst yet to come. Among non-viewers, 78% thought the worst is yet to come. Among frequent viewers, only 21%. So again, there's a very large gap, really different sets of reality between the people who are frequent viewers of Fox News and the people who don't watch it at all. So the next slide, we did something similar with conservative talk radio. So that's a smaller audience than Fox News, but even more conservative, I guess. So here you see the frequent listeners to conservative talk radio, people who occasionally listen, and people who never listen. And again, this is about mask wearing, worried about your own health, the government's priority, and the worst is yet to come. So mask wearing, 87% of the non-listeners say they usually wear a mask. Only a third, 33% of the frequent listeners do. Worried for your own health. 67% of the non-listeners worry for their own health or their family. Only 15% of the frequent listeners. Highest priorities containing the virus. 76% of the non-listeners, 3% of the listeners, frequent listeners. And the worst is yet to come, 75% of non-listeners and only 6% of listeners. Okay, so where was all this taken? I mean, this is a survey with a real so what message. This is talking about real life. If people are or are not wearing masks, that affects the health and of people around them, affects the course of the pandemic. It affects the recovery of the U.S. economy. So it's worth taking a look. What I've done here, this is just a timeline from March through end of August. And the gray bars here mark off the time when the people were completing that survey you just saw. So they were giving those answers about, is the worst yet to come or is the worst behind it? In this interval here, when the U.S. had a total of somewhere around 4 million COVID-19 cases confirmed. And since then, it's added something like 2 million more cases. That is just in the last month since the survey was completed. There have been about 2 million more infections. We're seeing something around 1,000 deaths per day. So, the worst was not behind us. And the people who said that back then, we already know that wasn't true. There's a quote in the brief that this is from Dr. Robert Redfield, who's director of the Centers for Disease Control and Prevention, the CDC. And he is himself an appointee of President Trump. And in an interview he gave last month, he said, this is more or less a quote, for your country right now and for the war that we're in against COVID, I'm asking you to do 4 simple things. Wear a mask, social distance, wash your hands, be smart around crowds. You do those 4 things, it will bring this outbreak down. But if we don't do that, this could be the worst fall from a public health perspective that we've ever had. Here, when he says the worst fall, he's again, along with many other experts, looking forward to the flu season and the season when people are more indoors than they are in the summertime. And there's more chance that of contagion. So the mask wearing, the future, the worst is behind us. The rest of the things we're asking about the survey, this is an example of the expert evaluation that's going on more or less at the same time that those survey opinions are being collected. I will mention that we've written, Tom Safford and I have written 3 other Carsey briefs describing earlier surveys in the pandemic, and all of these can be downloaded from the Carsey website. They have quite a bit more information, sometimes some different questions. So if anyone finds this interesting, I'd encourage you to take a look at those. And with that, I'll wrap up my formal talk and turn it back over to Nick and see if he has any questions.
Yeah, Larry, I want to talk about, you mentioned, I think earlier in your presentation about the similar survey being done in March. And are you kind of surprised by the difference in findings that you found back then compared to with this more recent survey? Is there, what are your thoughts on the difference, the different results there?
Well, there's some things the same and some things that are different. Something that's the same is we did our last survey back in mid-March, and things were just starting then. The Governor Sununu had not yet issued his stay-at-home order. But even before the stay-at-home order, we found that people were staying home. That judging by our survey in March, which was the first time we asked these questions, people were already making major changes in their behavior to reduce their exposure to COVID. And I think that what we see now is that we've got a more specific question about mask wearing, and we get fairly high compliance. That is part of the reason why New Hampshire has been spared the worst of the pandemic that we've seen in so many other places. If you look at, say, the New York Times or Washington Post, every day they have maps by states of how this pandemic is going, and New Hampshire is always among the best. That's not to say that it's good. We've had a lot of infections, a fair number of deaths, and that's tragic. But just compared with what's happened elsewhere, we've been fortunate. And I think these surveys show a good part of the reason, which is that people are responding to these ideas that you should take care. So that's in a way that's the same. What has changed is that I think, if anything, people are more pessimistic now. They're more cynical about the government. They see that the federal government is not planning to do anything at all, and is not coping with this. The U.S., I had a slide up a minute ago that I think had some numbers. Let's see. Yeah, the U.S. has 4% of the world's population, but 22% of the world's confirmed COVID-19 deaths. That's by far the largest gap between population and COVID of any rich country in the world. So we're doing much, much worse. So those two things, the New Hampshire residents are still very concerned. They're doing what they can, and you can see that in the statistics. But looking at the literature, they're more worried and more cynical about government now than they were in March.
All right, let's talk big picture. How can this data kind of shape policy discussion, policy decisions, and what do you really think this means? What do you think this means for the country?
Well, starting with the first part, the policy decisions, there's a lot of encouragement here for the argument that government needs to get the pandemic under control before they can restart the economy. So that if you restart the economy, reopen the economy while the disease is not yet controlled, you get the worst of both worlds. You got more sickness and death, and the economy is going to crash anyway when people see that. So I think people recognize that, but I think the federal government is pursuing instead not that policy at all. They're reopening the economy, and basically they're pursuing a strategy called herd immunity. And herd immunity just means doing nothing, letting everybody get sick until enough of them have immunity. And that depends on two assumptions for that to work. Two assumptions. One of them is very optimistic, and one of them is very grim. All right. So the assumption is that people have the virus. If they don't die, they recover, and then they have long-term immunity. So those are the optimistic assumptions, that you have it, you recover, and you have lasting immunity. We're just not sure that either of those is true, and there's some evidence that it isn't. The grim assumption is that even if that first one is true, to reach herd immunity will involve perhaps something on the order of 1 to 2 million American deaths. So when people in New Hampshire are in favor of controlling the virus, which is pretty much what the experts are advising anyway. And two, if we don't, things could be very much worse than they are today.
Do you have any last thoughts on this research, or do you want to plug some of your upcoming research?
Yeah, I don't think I'll say anything about what's upcoming at the moment. I'll just say that these graphs, these big gaps we see, depending on where you get your news, are, in a sense, it's the tip of the iceberg, because I do a lot of surveys on a lot of different topics, and we are more and more seeing Americans living in sort of different imagined realities, that you can ask questions about physical reality and get different responses depending on where people get their news. But they're just setting up different models in their heads about what's out there in the physical world. And this is showing up in all our surveys nowadays.
Excellent. All right. Great. If you want to read the research, you can go to carsey.unh.edu/publications. And it's also linked from our homepage, carsey.unh.edu. And I look forward to your next research brief, Larry.
Okay. Thank you, Nick. And it probably won't be very long.
Excellent.